Ed Holder, and the Acting Medical Officer of Health at the Middlesex-London Health Unit, Dr. Alex Summers. And a welcome to the media who are in attendance with us this afternoon. And a reminder, if you do have questions, and there are only a very limited number of questions in the queue already this afternoon, so don't wait to ask them. Just click on the question mark inside the text bubble here on Microsoft Teams. You'll find that near the top of the screen. And when you do ask those questions, if you could indicate your name as well as your media outlet and who your question is for. And finally, a welcome to the viewers who are tuning in this afternoon on Rogers Television, as well as the Rogers Facebook page and YouTube channel, and those who are watching us on the CTV London website. Let's begin with our opening remarks today, and we'll start with Mayor Ed Holder. Mayor Holder.
Well, thank you, Dan. Good afternoon, everyone. We crossed an important milestone as part of our historic vaccination drive in London, Middlesex earlier in the week. And it's one that didn't seem to garner a lot of attention, and I'd like to highlight that milestone in my comments. As of just a few days ago, more than 50% of all residents aged 12 and up have received a third dose of COVID vaccine. That's not only well ahead of the provincial average, it's one more reason why London Middlesex is one of the top 5 vaccinated jurisdictions in all of Ontario. So in addition to having more than half of our population triple vaccinated, we're now over 90% with 2 shots and 92.9%. Let me call that 93% with a single dose. So for all the talk recently about how vaccinations are a so-called divisive issue, the numbers I just cited say otherwise. When almost 93% of the population has opted in, and with hundreds more choosing to do that so on a daily basis, it's absolutely not divisive. Frankly, I'm paying little attention to the road warriors who aren't vaccinated, be they in trucks or be they in person in Ottawa, who think that somehow holding a city to ransom makes any sense at all, desecrating the war memorial, disrespecting Terry Fox's statue, that somehow they will garner support. They're not. And they know that what they're garnering is attention more than they deserve. Even by commenting on it today, I'm somewhat reserved about doing so because I don't want to give them that much more attention. But they're ignorant, and they do not do anything to further the cause of better health for all Canadians. So to you, 93%, bravo. Bravo. I am so proud of you. I'm hard-pressed to find an issue or any cause right now that has such overwhelming and unwavering support. And where restrictions are concerned, look, everybody's tired of them. We get it. Vaccinated and unvaccinated folks, I'm tired of them. But we started to see a loosening of the restrictions, and I see no reason why that won't continue along what I see as a cautious but steady schedule committed to by the Ontario government. And the real reason we're making the progress is this. We're quickly approaching a time where it's actually possible to live with the virus because of the 93% and counting who've gotten vaccinated. It's literally never been easier than it is today to get a shot. All clinics across London, Middlesex, well, they don't even require appointments anymore. You just walk in. So even if you've been infected with COVID, numerous studies and volumes of research demonstrate a vaccine provides longer lasting and stronger protection than does unvaccinated infection. That's what a true patriot knows. So it's never too late to get the shot, and I encourage everyone in the strongest possible terms, ensure that you get your first, your second, or your third shot as soon as you're able. Because for all of our sakes, you make the difference. So that's it for me, Dr. Summers, over to you.
Thank you, Mr. Mayor, and to those joining us this afternoon, thank you. It is a day to once again celebrate the vaccination campaign that we've had to date and to emphasize the critical role that vaccination will continue to play in reducing our requirements on public health restrictions. The 50% mark for those 12 and up being and having received a third dose of vaccine is a tremendous accomplishment, but we need to go higher. By continuing to have more people in our population boosted, more people vaccinated, we are in a significantly better position to not put further strain on our healthcare system and hospitals, and to avoid any further restrictions. This past Monday, those restrictions were lifted slightly, and we look forward to a day when those restrictions can be lifted completely. And our pathway there is clear. Our pathway there is through vaccination, particularly the booster dose for those that are fully vaccinated. For those that have received 2 doses and have not yet got the booster, I strongly encourage you to seek every opportunity you can to get vaccinated. Across the Middlesex-London region, as the mayor noted, all mass vaccination clinics are accepting walk-ins. You can book an appointment online at covidvaccinelm.ca, or if that's not convenient for you, just check the hours, show on up, and we will vaccinate you. The vaccine is safe and effective, and it's safe and effective the first time you get it, the second time you get it, and the third time that you get it. And it will continue to protect you not only against symptomatic infection, but most particularly against hospitalization and death. We continue to see more and more data that without the vaccine, your risk of hospitalization, particularly as you get older, is high. However, with the vaccine, and particularly that booster, your protection is substantial. We are also strongly recommending that 5 to 11-year-olds are vaccinated as soon as as well. And to that end, we are hosting an increasing number of community hub COVID-19 vaccination clinics in schools. And those will be happening throughout the month of February. 10 were initially booked and more are being added as we speak. Our first community hub clinic in school was hosted this past Monday at Wilford Jury Public School in London White Hills neighborhood, and 110 doses of vaccine were given. And we heard from people there that having the vaccine close to home made a big difference for allowing them to come out and get vaccinated. So we're going to keep doing that work so that we can meet people where they are at. Additional clinics are going to continue to be added, including a clinic added in the county at Glencoe this Friday, February 11th at Mosa Central Public School. And we'll continue to add these clinics to reach people where they are at. It is a day to again celebrate vaccination and to once again emphasize we continue to have the tool in our grasps to reduce our reliance on public health measures. Vaccination allowed for us to have a fall and an autumn in which we did not require public health measures despite the circulation of the Delta variant in our community. We can continue to do amazing things if we seek vaccination and reduce public health measures in our region, even in the face of the Omicron variant. Thanks to everybody who's rolled up their sleeves, and please take advantage of every opportunity you have to get vaccinated. Thanks for that, and back to you, Dan. Happy to take questions.
Thank you very much, Dr. Summers, and thank you, Mayor Holder. I mentioned we have a few questions. We actually only have one question in the queue this afternoon. So to our friends in the media who are joining us, if you do have a question, now is the time to get that one in. So let's go to that one question that we have, and that question comes to us this afternoon from Andrew Graham at Global News Radio 980 CFPL here in London. Dr. Summers, it's only February the 3rd, but already the health unit has reported 10 deaths with COVID-19, related to COVID-19 this month. Is this expected to continue throughout the month, or are we seeing signs that the tragic loss of life may be slowing down?
Thanks, Andrew. I appreciate the question and recognize the tragedy that we have experienced with every death associated with COVID-19. This past January of 2022 saw 46 deaths in our region. It's the second highest number of deaths we've seen by month since the beginning of the pandemic. The highest month for death counts was January of 2021, a year ago this past month. in which we saw 71 deaths over the course of the month. I want to highlight that, in fact, the 46 deaths compared to the 71 deaths from the year previous highlights the importance of vaccination. We had substantially more cases in January 2022 than we did in January 2021, and yet we had significantly less deaths. Why? Because of the protection the vaccine provides against hospitalization, ICU admission, and death. The Ontario Science Table shows that unvaccinated people have a 6-fold higher risk of being in hospital and a 12-fold higher risk of being admitted to ICU in comparison to those that have had 2 or 3 doses of the COVID vaccine. That's a remarkable difference. And if you are going to protect yourself and give yourself the best chance against death, hospitalization, or ICU admission, vaccination is your pathway. As February unfolds, we will continue to see deaths from COVID-19. We will see higher rates of death amongst those that are unvaccinated. The health unit is reporting 3 deaths today. 2 of those individuals, sadly, were unvaccinated. The 3rd one was vaccinated. We will see a decline in the number of deaths as the case counts come down. And so certainly the trends of the last few weeks are encouraging, not just for where we're heading broadly, but also with where we're heading for the number of deaths we will see. But again, we continue to see significantly higher rates of COVID in our community than any other time in the pandemic. And so we will continue to see deaths. And that's all the more reason why it is never too late to get vaccinated. And it is always important to continue to keep your social circles small, stay at home if you're unwell, and of course, wear your mask. Thanks, Dan.
Thank you, Dr. Summers. And we do have a follow-up question from Andrew Graham. And I know that there are some members in the media who do have a bit of a delay in between when we are live and when they're able to see the stream. So again, if you have a question and you are a member of the media on the call this afternoon, now would be a good time to get that one in. Let's go to a follow-up question from Andrew Graham. Dr. Summers, you had mentioned earlier that Omicron appeared to be plateauing in the region. Is that still the case?
Across the province for the last number of weeks, all significant metrics show a decline in COVID-19 transmission in our community. Those metrics include the case counts, again, acknowledging that the case counts are only a representation of a select part of our population that's eligible for testing. However, the trend is still important for our whole community. So the case counts are declining. Percent positivity is plateauing and declining. Wastewater data is also plateauing and declining, and that's being seen across the province. It's happening because of booster dosing and because of reduced social contacts for many people in our community. As we reopen, we may see and likely anticipate an increase in COVID transmission, although there's significant uncertainty around where we are headed as we reopen. That uncertainty is because we don't yet know how many people actually were infected with Omicron and as a result are not susceptible in the immediate future. Therefore, we're still uncertain, and that's why we're asking people to continue to do what we know will be effective regardless. Get vaccinated, wear a mask, reduce your social contacts as much as possible.
Thank you, Dr. Summers. Next question comes to us from Nikita Chu from the Western Gazette. Dr. Summers, can you please comment on the London and St. Thomas elementary schools transitioning back online due to the lack of teachers? Nikita, I will mention that Dr. Summers would be able to speak to London, but St. Thomas actually falls within the jurisdiction of Southwestern Public Health. So with that, Dr. Summers, any thoughts about the schools transitioning back online due to the lack of teachers?
Thanks for that question, Nikita. Schools that have transitioned to online learning have done so because of operational constraints associated with staffing, and that situation and those contexts are certainly best described by our partners at the respective school boards where these schools are located. Certainly from a public health perspective, we are not closing schools as a result of absenteeism, both for staff or for students, but there may be operational reasons to do so, and the school board would make those decisions independently.
Thank you very much. Another question now from Calvi Leon at the London Free Press. Dr. Summers, the number of COVID-19 related deaths reported continues to be those who are in their 60s or older. What may be working to help older adults and seniors to stay healthy?
Yeah, thanks for your question, Calvi. Certainly, when we look at severe outcomes, it really certainly is stratified or distinguished by somebody's vaccination status and most notably by their age. And this has been a consistent trend since the beginning of the pandemic. The most significant predictor for a poor outcome from COVID-19 is someone's age. As you get older, you are more vulnerable to severe outcomes. When we look at what is effective at protecting those who are older, there is no single replacement to vaccination. If you are of any age, but certainly if you're over the age of 50 or 60, it is critical that you are as up to date on your vaccine as you can be. For most people, that's 3 doses, 2 original doses plus that booster. And for those who live in long-term care and retirement homes, it's now a 4th dose. It's an additional booster that is being distributed as we speak. The ongoing efforts to vaccinate this population is absolutely critical. And for those over the age of 70, 80% of those individuals over the age of 70 in our region have received a booster, which is tremendous, and that will continue to be one of the most important things we can do. In addition to vaccinating those over the age of 50 and 60, the other critical thing is to make sure that those around them are vaccinated. Staff, essential caregivers who work with these individuals, friends and families who are visiting folks either in their homes, socially or otherwise. We can create walls of protection that decrease the risk of transmission to those who are most vulnerable. And so by getting ourselves vaccinated, we're not only protecting ourselves, we're protecting those around you, and most in particular, those of older age who may be more vulnerable to COVID-19.
Thank you very much, Dr. Summers. And we have a follow-up question from Calvi Leon from the London Free Press once again. And I will mention one last time, that we are getting to the end of our questions. So if you are waiting, now's the time to get that question in. All right, let's go to Calvi Leon's next question. Dr. Summers, are you satisfied with the uptake for 3rd dose booster shots in recent weeks? What steps do you think need to be taken to get more shots into arms, especially as restrictions ease?
Thanks for that question, Calvi. The uptake in booster doses, as well as 1st and 2nd doses for 5 to 11-year-olds, has started to plateau. And that is understandable, but also worrying because, as I mentioned before, we want to see vaccination, particularly boosters for the older population, increase as much as possible. Therefore, we really, again, want to take every opportunity to emphasize for people of all ages the importance of vaccination. If you are 18 and older, you need to get your booster dose. And if you've not received a 1st or 2nd dose, you need to get that journey started for yourself, not just to protect yourself, but to protect those around you and to be able to participate in all the activities that we know people value, such as going to restaurants, such as traveling, etc. In terms of steps that can assist and improve vaccine uptake, particularly boosters amongst those in 18 and older, I think there's a few things that the health unit is going to do and a few things that we as a community and as a province need to do as well. We want to make sure people have an opportunity to ask and answer their questions, and that's what these media briefings are for, in addition to our social media work and all the good information you can find on our website at healthunit.com, which can talk about the absolute critical importance of getting that booster dose. It's also critical to get that booster dose even if you've already had COVID-19. Immunity from COVID-19, if you've been infected with the virus, can wane over time and you can get reinfected. And we've seen reinfection of individuals who had the Delta strain who subsequently also get the Omicron strain. So it's really critical to take every advantage to protect yourself without getting the infection. The vaccine can increase your immunity even if you've previously had COVID-19, and it continues to be safe and effective. The more we give this vaccine, the more we realize how safe it is. And so there are very, very few reasons not to get this vaccine, and very few people are not able to get this vaccine. We will also be doing expanded mobile clinics to take the vaccine to neighborhoods where potentially access is limited. We want to make sure that people have every opportunity to walk in and get vaccinated, which is why we've moved to walk-in doses and walk-in appointments at all of our mass vaccination clinics. And as I mentioned, you'll see more mobile opportunities over February and into March. We also know that decisions to require 2 doses of vaccine to participate in things like attending a restaurant or going on campus made a big difference in providing additional incentives to people to get 2 doses of vaccine. Those tools will continue to be effective and helpful in encouraging people to get a 3rd dose of vaccine as well. So as we look towards enhancements or expansion of requiring vaccination to do some of those activities, that may also, if the province heads in that direction, increase vaccine uptake. Notably, we saw it increase vaccine uptake significantly last summer and into the fall.
Thank you very much, Dr. Summers, and thank you for the questions, Calvi. That does bring us to the end of our questions for this afternoon's virtual media briefing. Thank you, Dr. Summers. Thank you, Mayor Holder, for your participation as always. And we will be back with our next virtual media briefing. That is coming up on Monday afternoon at 2 p.m. So that ends up being the 7th of February, Monday, the 7th of February, 2 o'clock. We hope you'll join us then. So between now and next Monday afternoon, have a great rest of your Thursday. Have a wonderful weekend, and so long.